Hey, everybody. I think we have figured it out. So thank you so much for joining me. This is sort of take two. We were hoping to do our live Q&A on cat lymphoma last night, but Facebook was kind of broken, as was Instagram. So if you're joining me on Instagram, we're only going to be here for a few minutes, but I just wanted to hop on Instagram and remind everybody to join us on Facebook for the live Q&A on kitty lymphoma that I attempted to do last night, but everything was sort of broken. So again, if you have any questions, I'll be taking them on Facebook. And everybody, I hope that you will hop on Facebook and we can get going. And I'm going to do a little bit of a review on kitty lymphoma. We'll talk a little bit about high grade and low grade lymphoma, and then we'll definitely get into your questions. But we're going to review who gets it, why they get it, what we see. So what are the symptoms? We'll talk about early detection, how we treat it predominantly with chemotherapy, and we'll talk a little bit about the diagnostics that we use. So what testing you might be asked to do when you bring your cat in to your veterinarian for lymphoma, or go see someone like me, a cancer specialist. And prognosis, so how do kitties do? And that's one of the things that we'll talk about is cats are just a little bit all over the place when it comes to lymphoma. They're a little bit less predictable and harder to predict for pet owners. So that is the plan. And then we're going to do your questions. So I'm seeing people hop on both sites. So I'm super, super excited. Thank you everybody for your patience. It was a little bit of a cluster last night because we just, everything just didn't work. I thought we were going to be able to hop on, but we couldn't. So welcome everybody. I'm really, really excited that you're here. My name is Dr. Sue Ettinger, if you don't know who I am, also known as Dr. Sue Cancer Vet. Hi, Amanda. Hi, Laura. Thanks, guys, for hopping on. Hi, Danielle. Great to have you here and helping me out tonight. So I can't do this all alone. So Danielle is going to be behind the scenes, and she's going to help drop some links in as I mention things. So, a lot of the different sites, my website, YouTube, different resources that I have for you. Danielle will definitely be popping them in so you guys can go to that as we go along. But again, guys, just as a reminder, if you're on Instagram, in a few minutes, I'm going to cut you off, and I would love for you to hop on Facebook. And if you miss this or you have to leave for whatever reason, the replay will be on YouTube, on my channel on YouTube. So whichever site you're on, my little plea is to please subscribe to me on YouTube, because I'm really trying to build that and get good information out for you guys. Okay, so my name is Dr. Sue Ettinger. I'm a boarded cancer specialist. I work in the Metro New York area in Connecticut, but I love to get online. And hi, Robin. So Robin, one of my kitty clients that I'll tell you more about Miku later, got on. She was also struggling with the internet last night. So I'm a cancer specialist in the Metro New York area. I'm currently in Norwalk, Connecticut at the Veterinary Referral and Emergency Center. I just changed practices, been there for a couple of weeks. So if you're looking for me and you can't figure out where I am, go to my website, drsuecancervet.com, and there's you can see where I work and you can find me there. But not everybody can come to the Metro New York area, so I'm here to help you guys, and we are going to be talking about kitties with lymphoma. So let's talk a little bit about it. So first off, what is lymphoma? So lymphoma is a cancer of one of the white blood cells called the lymphocytes. And when those cells transform or become malignant, that is when we get lymphoma. And lymphoma in kitties is definitely different than what we see in dogs and people. So in dogs and people, it's like non-Hodgkin's lymphoma, and that's when they get big lymph nodes. So when I say lymph nodes, I'm talking about glands. So like, guys, when you have strep throat, if anybody had strep throat this year, and you say, oh, my glands are swollen, we're talking about the same thing as lymph nodes. So when you have lymphoma, these lymphocytes, these cancerous cells accumulate in your lymph nodes. In dogs and people, usually it's under the jaw, in front of the shoulders, and behind the knees. But cats are totally different. So when we see lymphoma, it tends to accumulate internally. And the most common locations that we're going to see it are within the abdominal cavity, usually associated with the gastrointestinal tract. So usually the small intestines and the lymph nodes deep in the belly. So you're not going to usually be able to feel anything on your cat. So when we talk about early detection, there's symptoms that you're going to be looking for at home. And, it's going to be an astute owner. And we're going to talk about how we can find that early. Okay, so it's a cancer of one of the white blood cells. It is a treatable cancer, guys. I'm going to say that again. Lymphoma in cats is a treatable cancer for sure. Cats that get treated live significantly longer than cats that have no treatment. So they live longer and they live well. Why do they live well? Because they tolerate chemo very well. Of dog, cats, and people, who tolerates chemo the best? Cats, right? And I know that's really surprising. I was really surprised during my internship and residency when I did my first oncology rotations. I was like, really? Those little kitty cats, they're going to be the ones that tolerate chemo the best. So they really tolerate chemo the best, and that's very surprising. So what's frustrating about cats with lymphoma is that it is less predictable. So last month we talked about dog lymphoma, and I said if they go on a good multi-agent chemotherapy protocol, 80 to 95% go into remission. And the problem with cats, it's about 50 to 80%. So it's lower. And what we know is so important for long-term survival in kitties, guys, is cats that go into complete remission. And the cats that go into complete remission can live 1 to 2 years. But the cats that don't go into complete remission it can really suck. I mean, I'll be honest, it can be, 3 to 4 to 6 months, and they really bring those statistics down. So I really think of kitties with lymphoma into two subsets: the responders that are going to live really long, and then the cats that don't respond. And usually it takes treatment to figure that out. Dr. Sue, would you treat your cat if it had lymphoma? The answer is yes, and I did. Okay, so that's often a question that I get. Doc, what would you do for your cat? I would absolutely treat. So I would treat my kitty for lymphoma. And like I said, they live longer and they live well. And we'll talk about that with different in survival times. Okay, so again, guys, if you're just hopping on, I'm doing a brief overview of kitties with lymphoma before we get to our Q&As. Okay, so which kitties get it? In general, lymphoma is a cancer of middle-aged kitties, so about 10 to 12-year-old kitties. And someone just put up a question or something about an FELV positive kitty. So cats that are feline leukemia positive are about 60 times more likely to get lymphoma. And unfortunately, once they have lymphoma, they are less likely to respond to chemotherapy and live as long as a cat that is feline leukemia negative. I know it sucks. A cat that is FIV positive is more likely to get lymphoma, about 5 to 7 times more likely, but just as equally to respond to chemo. So it's not a negative predictor for response. So they're more likely to get lymphoma, but they will still respond as well to chemo as a cat that doesn't have feline FIV, okay, that is FIV negative. Another thing, guys, that has been associated with getting lymphoma is environmental tobacco smoke. So kitties that are in the homes with smokers are 2.5 to 3.2 times more likely to get lymphoma. So when people say, what can I do to decrease the likelihood of my kitty getting lymphoma? We do know that being in a household with environmental tobacco smoke has been associated with getting lymphoma. Okay, so where do we typically see this cancer? The most common location is the gastrointestinal tract and the mesenteric or the abdominal lymph nodes. We also see it in the nasal cavity. If you had to be a cat and pick lymphoma, I know oncologists ask weird questions or say weird things. We'll talk about the small cell form after Sarah. But the nasal form is one of the better forms. And Robin, who's came on as John, who's one of my clients, I've been treating Miku, and Miku is out 6 years, and Miku had nasal lymphoma. So that is definitely, a long-term survivor and a kitty that made a liar out of me. But it's great. I'm always happy when I'm wrong. But in that case, is a really good example of one that nasal kitties tend to respond the best, and that sometimes I'm wrong, and they're statistic busters, which always make me super, super excited. So we see it in the GI tract, which again can also be the abdominal lymph nodes. We could see it in the liver. We can see it in the spleen. We could see it in the kidney tract, in the kidneys, and we can see it in the skin as well. So those are some of the places that we are going to see. There are other places that we can see. You can see it in the mediastinal lymph node, the lymph node that's in front of the chest. And that is usually associated with cats that are feline leukemia positive. So guys, I'm not going to, I do a full hour lecture. I have 2 hours of lectures when I go to different conferences for veterinarians. So obviously, I'm not going to cover everything about lymphoma, but I'm just trying to give you the 30,000-foot overview. So we're a little bit all on the same page as we go through the questions. So, you might say, oh, she didn't mention there, and I had a cat that had it in this location. Yeah, sometimes we even see it in bone. So again, there's going to be things that I'm not going to be able to get to. So we talked about who gets it, but importantly, what do we see? So again, this is not something that you guys are typically, as pet owners, going to be able to feel like a lump or bump. I'm all about early detection. So Kathleen is saying, yep, her FELV positive kitty has the mediastinal form. Yep, and that's the classic, and that tends to be younger male kitties. What do we see? For the gastrointestinal form, the symptoms are vomiting, diarrhea, loss of appetite or anorexia, some, we're along that spectrum of not wanting to eat, and weight loss. And sometimes, guys, it's just weight loss. And so that can be very confusing because they're not really having GI signs. They're not having vomiting and diarrhea, but weight loss alone may be the only symptom that you see. And this will be both for the high-grade, more aggressive lymphomas and the low-grade lymphomas. They can have those symptoms. The difference between the high-grade lymphomas and the low-grade lymphomas, there's lots of differences, but one of them is that the high-grade ones, they get sicker quicker, usually within days to weeks, and they need aggressive chemotherapy. And the low-grade ones, it tends to be a more chronic process over weeks to months, often 3 to 6 months of weight loss, vomiting, and diarrhea. So this is where, when we talk about early detection, guys, vomiting is not normal in cats. I'm going to say it again. Vomiting is not normal. So the excuses that we make, they eat too fast, they're a nervous eater, they get hairballs, are not good excuses. And what we're learning, is that vomiting is not normal. So if your cat is vomiting more than a couple of times a month, it's a good indication that you should go into the vet for the next step, which is an ultrasound to see if their intestinal tract is too thick. And then we often need to do biopsies to confirm the diagnosis. Okay. For the other signs, if they have nasal lymphoma, they often have runny nose, discharge, sometimes a facial deformity. If it's in the kidneys, they're going to have signs of kidney failure, increased urination, increased drinking, weight loss, vomiting, things like that. So again, it's going to be hard to completely cover everything, but that's sort of the overview. Early detection is a huge thing. One of the other things, weight loss is really hard. My own kitty, which started out as inflammatory bowel disease and progressed to lymphoma, it took my mother-in-law coming into town, and I'm married to a vet, to really notice that our cat had lost weight. So guys, it's really hard when you're with your pets every day. And so it really highlights the importance of getting our kitties weighed, whether it's going into your vet. I'm sure your vet would be happy for you to pop in regularly and weigh your kitty, or getting a kitty scale, or weighing your cat at home, because weight loss is really hard. And there are other diseases besides cancer that will cause weight loss. So in cats, we think of hyperthyroidism, diabetes, and kidney disease. So again, weight loss, monitoring our kitty's weight is definitely a good thing. And we'll talk about, yes, low-grade lymphoma can morph into high-grade, and IBD, inflammatory bowel disease, can morph into low-grade lymphoma. So that chronic inflammation has been associated with transformation into low-grade lymphoma, and that's exactly what happened to Jeter, my orange kitty. How we treat, so we treat with chemotherapy. High-grade lymphomas, regardless of whether it's gastrointestinal tract, kidneys, liver, we're going to treat with a multi-agent chemotherapy protocol, like a CHOP or a COP chemotherapy protocol. A low-grade lymphoma, especially the small cell lymphomas of the intestinal tract, usually going to be steroids like prednisolone combined with chlorambucil, which is also known as Leukeran, oral chemotherapy, more chronic. All right, I know I'm giving a lot of information. I kind of wanted to get through this so we could get to the questions, because I know you guys have lots of questions. But again, I wanted to just give a nice overview of lymphoma. And then, so chemotherapy, and I'm sure there'll be lots of questions about that. In general, to confirm the diagnosis, guys, this kind of goes before we treat it with chemo. The high-grade lymphomas, usually it's going to be an aspirate, so we stick a needle in it. I love aspirates. And then we're going to look at those cells under the microscope. Usually cats with high-grade lymphoma don't need to go to surgery to get a diagnosis, which is different than cats with inflammatory bowel disease and IBD, inflammatory bowel disease, which is IBD, and low-grade lymphoma. Those kitties usually need some form of biopsies, whether it's endoscopy or surgical biopsies, because it can be very hard to distinguish the two. So again, those kitties usually end up going to surgery to get their diagnosis. Prognosis. Okay, so I mentioned this in the beginning. Cats that go onto a multi-agent chemotherapy protocol, CHOP or COP, with high-grade lymphoma tend to do better. The cats that respond, those will be, the median will be 1 year, with about 25%, 2 years, and then there will always be wonderful exceptions to the rule, like Jojo and Miku, my kitties that are out like 6 and 8 years. And they can relapse. Jojo relapsed 2.5 years later, got more chemo, and then and then is still out in remission. So, but again, the non-responders usually, 3 to 4 months, 4 to 6 months. So again, those non-responders really bring the numbers down and make predicting cats a little bit more challenging. Some locations do worse than others. So nasals do better, kidneys notoriously do worse, and so forth. So we can talk a little bit about that. And finally, the low-grade ones, those tend to, remission is often defined as resolution of their signs, the vomiting, the diarrhea, the weight loss, their appetite goes back to normal. And most of those kitties will live about 1.5 to 2 years and be on chronic chemo, usually forever. All right, people on Insta, if you have questions, we're going on to Facebook. Thank you for joining. Hopefully you'll join me on there with any of your questions. So I'm going to end this and we're going to focus completely on Facebook. All right. Okay. All right, guys, you have my undivided attention. So that was our overview. I hope that was good, but again, and that answered some of your questions. But the rest of the time is going to be for questions, and we can talk about that. So I am going to scroll and see which way and see which questions we have. Robin is here. Okay, so Kathleen says we began treating one of our FELV positive kitties. So, going back to, I mentioned, so cats that are feline leukemia, sorry, just turning off my phone. Cats that are feline leukemia positive, sorry, I was just looking at some of the questions. Cats that are feline leukemia positive is a negative prognostic factor, a negative predictor. So often they will have shorter survival times, but I still would treat them with chemotherapy. But thank you for saying that. That was a good overview. I appreciate that. So, but I love to be wrong and I love when they do well. But again, cats that are feline leukemia positive tend to be a little bit tougher to treat. Okay, and Kathleen says, love that you're talking about kitties. I know sometimes kitties and cat owners feel like they don't get enough attention in veterinary medicine and definitely in the oncology world. So Sarah says, let's see, trying to see how I remember how to view these. Okay, so Sarah says, is the small cell form easier to treat and associated with a longer survival than the large cell and more likely to respond? So the answer is yes. And so I kind of mentioned that in the overview, but I know it was really quick. So I'm going to kind of slow down because I wanted to get through that in about the first 15 minutes, which was my goal. And I think mission was accomplished. So the small cell, it's easier to treat because they're usually going through oral chemotherapy. So it's not as intense for the family because they're not coming in as often. So for the high-grade lymphomas, the best chemotherapies, the CHOP and the COP chemotherapies, which are these multi-agent protocols, and usually you're coming in weekly for the CHOP multi-agent protocol. So that's an abbreviation for the different drugs in the protocol. You're coming in weekly for about 2 months and then every other week for the remainder of 6 months. So it can be more expensive and it's more of a time commitment for the family because you got to get into your veterinarian or to your oncologist. For the small cell, we're usually using a combination of oral prednisolone, which is steroids, with leukeran, which is also called chlorambucil. And usually I see them back in 2 weeks and then in 2 weeks, and then the appointments go to monthly and then usually every 6 weeks. They can still have some of the side effects that we see, the low white blood cell counts. With leukeran, sometimes we'll see delayed low white blood cell counts, delayed low platelet counts, and sometimes liver toxicity issues. So it's still really important that you're going into your veterinarian for that blood work. But that is why I would say it tends to be easier to treat, because the cost is less expensive and the time commitment of the frequency of trips to your veterinarian. And they tend to do better, because again, most of those kitties I talked about that respond, their symptoms resolve, the vomiting, the diarrhea, the weight loss, the appetite goes back to normal. And we see about 1.5 to 2 years. Some of those kitties don't respond. I've had some kitties relapse, 6 to 9 months into it. And then the owners say, but you told me they were going to do better. So that, again, there will always be exceptions to the rule on both sides. Some kitties, as I mentioned earlier, with small cell lymphoma will transform to high grade. And in my personal experience, those have been really tough high grade lymphomas that when I try them on injectable chemotherapy, like a new high-grade lymphoma, they tend to don't respond as well. So that can be a little bit more frustrating. Kathy says every kitty guardian should try to have a baby scale. Yeah, I really think having a cat scale, and they're not that expensive. So one of my clients just ordered one from Amazon, actually for their small dog. Because again, and I love to tell you guys where I've made mistakes along the way. And I tell other veterinarians because I think it keeps it real. So again, our own kitty lost about 3 pounds. And I think my sister-in-law is on here. So yeah, her mom was the one who came in one time for Thanksgiving and noticed that our kitty looked really thin. And I'm married to another veterinarian. But guys, when you're with your pets every day, it can be really, really hard to notice their weight loss. So again, if you don't have a baby scale and you have a scale, you can weigh yourself, weigh you with your cat, right? And do the math. That can work as well. But a baby scale is going to be more accurate. But again, you can just get a baby scale off Amazon and have it shipped right to you. So Kathleen asked, what is Elspar? So Elspar is a chemotherapy drug. It's also called L-asparaginase. It's often used in the beginning of chemotherapy protocols. I also love it. I use it. I also love it when they relapse. It's really good at getting them back into remission. It's also a great drug that's effective for dog and cat lymphoma that doesn't cause a low white blood cell count. So if your kitty comes in, or if a dog comes in one day to see me and they're due for chemotherapy that's likely to cause a low white blood cell count and they're low from last week's treatment, I'll give a dose of Elspar because it's not going to lower their white blood cell count. Their bone marrow is going to have time to make more white blood cells, and I can still keep treating their lymphoma. But commonly, Elspar is given in the beginning of chemotherapy protocols. So technically, the CHOP protocols will be called CHOP-L for that L-asparaginase. So did you get my invite to Healthy Dog Expo on April 6th? Lori, I did not get that. So if you want to send that again through my website, through the email, contact me. I think I might be in Minnesota that day, but you can send that. So Jennifer Cooper is my sister-in-law. Hi, Jennifer. How are you? Is excessive sneezing with no other, I hope you didn't mind I told people who you are. I thought there was a way to show comments, but I can't figure it out at the moment. Agenda, show, we got kitty lymphoma, can hide that. I thought there was a way to show the comments. Let's see. There we go. Yay, I figured it out. Okay. Sometimes I'm technologically challenged. Okay, so is excessive sneezing with no other signs discharge a symptom? So it could be. That's the long and the short of it. So now we're thinking about nasal lymphoma. And I know like sometimes listening to, me, you're like, oh my God, my cat's doing this. And could it be that? So, and I'm not trying to get us all freaked out, but I just want us to be educated so we can be aware, because what I see sometimes with gastrointestinal lymphoma are cats that have lost a lot of weight or have been vomiting and diarrhea for a while. And we haven't been thinking about, that cancer or IBD could be on the list of possibilities. Or cats have had chronic runny noses and they've been on and off antibiotics for a while, and then we do a CT scan and we do diagnostics and we find out that they had nasal lymphoma. And often cats that have nasal lymphoma, so have nasal lymphoma in the nasal or the sinus cavities, they have secondary infections. So they often do respond to antibiotics for a little bit. So sneezing with no other signs of discharge, probably not. Usually cats that have nasal lymphoma will have discharge. It could be clear, it could be yellow and gunky. Again, sometimes they'll have pretty severe facial deformity. Sometimes one of their eyes will be a little bit displaced to the side, and sometimes their face will be completely normal. So it really depends if it's sort of growing in and in the sinus cavities. So sneezing alone, probably not. But, and cats can also get upper respiratory infections as well. So again, it's not going to be the only thing. So again, this isn't to make us all freak out. This is to just get us educated. So if our cats are having issues, we can have good conversations with our veterinarians. Let's see, next question. My cat went into heart failure after prednisolone, so I'm afraid to start anytime at chemo. Okay, so the question is about using a cat that went on steroids with heart failure. So most cats, if they don't have pre-existing heart disease, using prednisolone steroids is not going to push them into heart failure. If they have pre-existing heart disease or undiagnosed heart disease, steroids can cause heart failure. But that wouldn't be a reason not to use chemotherapy. You just might need to talk to your oncologist or your veterinarian about not using steroids and talking to the cardiologist. So I have had cases where I've worked with a cardiologist and they said, you know what, due to the echocardiogram, the ultrasound of the heart, and the contractility of what's going on with the heart, I really don't want this cat on steroids. And you can, use chemotherapy without steroids. In dogs, there was just a study that showed that dogs that got the CHOP multi-agent chemotherapy without steroids did equivalent as to dogs that got the chemo with or without pred did equivalent. So again, I wouldn't not give your cat chemo if they can't get steroids. And she's saying I have to torture him with Lasix syrup daily, which is for the heart failure. So, if you haven't seen a cardiologist, it might be one where getting a cardiologist in your cat's medical team is going to be helpful as well. But yeah, that's hard, when you're managing two different diseases and, a cat that goes into heart failure is going to be really stressful. And I'm really sorry, Kim, that you're going through that for sure. But I wouldn't say from a medical standpoint, just because your cat has, and again, I don't know how bad the heart is, but I wouldn't say just because they have heart disease, they can't go on chemo. It may be that they just can't get steroids. Okay. Okay, this is a great question, Laura. So Laura is asking about the low grade. So I've used a couple of terms interchangeably, guys. So low grade lymphoma is often called small cell because the cells are smaller, and high grade lymphoma, the more aggressive ones. And again, those can still be in any organ, nose, GI tract, liver, kidneys. We will use high grade and large cell lymphoma interchangeably as well. And those are the kitties that we usually put on the multi-agent injectable chemotherapy. So her great question is, for small cell, do you have any thoughts about pulse versus 3-week dosing for chlorambucil, which is also called Leukeran? So I do have a preference, but I can't tell you that one has been shown to be better than others. So there's a couple of different ways. There's probably at least 3 different ways that you can potentially give Leukeran. The way that I like it, and again, it's depending on the size of your kitty. If your kitty's a little over 8 pounds, they usually start on every other day Leukeran, and then about a month later, they go on to every 3rd day. If they're a smaller kitty, they usually start on every 3rd day, and then after a month, they go on to about every 4th day. I have had kitties gain so much weight as I've gotten their cancer under control that they have to then go back up to every 3 days for their maintenance. There are some protocols where they get higher doses for 3 days in a row every 3 weeks. And then there's another protocol, which I've never used, where they get not crazy, but a much higher dose, I think once every 2 weeks. And those are called these pulse dosing versus the chronic dosing. I like the chronic dosing. It just has worked well in my hands. I did try the pulse dosing. I have done that for some owners who absolutely can't pill, and I've always had a hard time pilling my kitties because I've had clients who would bring in a veterinary technician or assistant 3 days in a row to give their cat the chemo at home, the pills, and then they wanted to be done with it for the next 17 days until the next 3-week period rolled around. But personally, I like the chronic dosing where it's, like I said, every other day and then every 3 weeks. Has one been shown to be better than the other? No, Laura. So I would probably make the decision on what works best for you and your lifestyle, and maybe what your oncologist recommended. But again, I like the chronic dosing, and I've had really good responses personally, and that's all I can tell you. Another great question. You guys have great questions tonight. So Miriam is asking, how long after the start of chemo is a cat considered non-responsive to chemo? And what about being partially responsive and undergoing changes in drugs to find a better response? So that is a fantastic question, Miriam. Thank you for asking that. It's like I planted that one. I'm gonna take a sip of tea. Ooh, that tea's still hot. Okay. Hopefully you guys are still finding this helpful. Okay. So before I answer this, remember what I said in the beginning. Which kitties do better? What one of the most important things for cats with prognosis? There's like 3 or 4 things that I think when I'm sitting in the room with an owner, when I'm talking about is this what are the prognostic factors? Because some studies, they have little random things, but feline leukemia positive. So cats that are feline leukemia positive don't do as well. Cats that are sick at diagnosis, that are showing symptoms, don't do as well as cats that are healthy at time of diagnosis. Cats that get a multi-agent chemotherapy protocol are going to do better than maybe a cat with high-grade lymphoma that just goes on single-agent oral lomustine or doesn't get treated or just get steroids. And then finally, cats that go into a complete response do better than cats that have no response, partial response, or stable disease. So I'm not saying if all I can do is get a cat to have a partial response, I'm going to stop and say it's not worth it, but I will change protocols. So for the CHOP multi-agent chemotherapy protocol, it takes about 4 weeks for them to cycle through all the different drugs. So vincristine, cyclophosphamide, the Elspar that they get in the beginning, and then the doxorubicin. I usually like them to be in remission by the week after they come in for their doxorubicin, because I'm about to repeat the cycle. So if they were coming in and they're not in remission, then I'm going to consider, changing protocols. How do we know they're in remission? So say it was a cat that had multiple high-grade lymphoma, multiple lymph nodes in their belly, and they had a palpable mass, so I could feel it on exam. I still and we're not sure that, maybe they're still having some vomiting and we're not sure if it's the chemo or the cancer. The best way is going to be, an abdominal ultrasound. That's going to be the best way to really figure out. So, if they had kidney lymphoma, it's going to be an abdominal ultrasound. But again, usually by the time that I'm about to repeat the cycle of chemotherapy, I'm going back to give them their next round, starting with vincristine, and they're not in a complete remission. And there's lots of other protocols for me to try. That's when I'm going to switch chemotherapy protocols. I have had kitties where I've tried lots of different protocols. The best I can do is a partial response, but the cat's doing great at home. They've gained weight and they're really feeling well. And I tell the owners, statistically, they'll do better if I can get them in a complete remission, but they're doing really well. They're gaining weight and their symptoms have improved and they're doing really well. So I'm going to keep going with a cat that is in a partial response. I just, caution the family that maybe the kitty's not going to do as well as if we could have gotten him or her into a complete response. So yeah, I would definitely change the protocol. So Sarah's question is, how do I know if my cat is in remission if the only symptom he has was weight loss? If they show less symptoms, do they have a better prognosis? So yeah, that kind of goes in with what I was asking. So if weight loss was the only symptom, I wonder if this is low-grade lymphoma, but so how do you know they're in remission? They should be gaining weight, right? And so for cats that have low-grade small cell lymphoma, it is going to take, it's a slower chronic disease, and it's going to take them longer to respond and get them into remission. So it could take a couple of months before I'm seeing them, all their symptoms resolve, and that weight gain can really take a while to get back. But I want to see steady improvement. The high-grade lymphomas, those large cell lymphomas, those kitties, again, I told you by a month into the protocol, we're really seeing, you're welcome, Miriam, you're really seeing them respond. So again, the hard part about cat lymphoma is that there's one name for this low-grade process and this high-grade process. And even though they're cancers of the same cells, they're a little bit different. So if something I'm saying doesn't jive, it may be because your cat has low-grade and I'm thinking about high grade. But again, if if the only symptom is weight loss, how do you tell them in remission? they should be gaining weight. So I'm guessing it was low grade because often those kitties can still have a normal ultrasound, but on biopsies they had, they had small cell lymphoma. Cyberknife radiation prior to chemo. Robin, who is Miku's mom, who's the kitty that I treated for large cell high grade lymphoma in the nasal cavity. So that is a good point. She's bringing up that we used radiation. So that is one of the areas where, so for nasal lymphoma, when it's in the nasal sinus cavities, studies show that cats will do better if you combine radiation with chemotherapy. If you're at an area of the country where you can get to radiation, that radiation will definitely add to the cost. I would do chemotherapy alone, but kitties do best if you can combine radiation with chemotherapy. Most of the time with cats with lymphoma, we think about chemotherapy as the treatment of choice. We don't typically, it's not a cancer that you can cut out. There will be cats with high grade, the large cell, the more aggressive lymphoma in the GI tract that will go to surgery in the beginning because it's completely obstructing the gastrointestinal tract. Nothing can get in. Sometimes it even actually ruptures the intestinal tract. And so those kitties, they can't wait for chemo to have, because they're completely obstructed. So sometimes those kitties will go in, they'll have GI surgery, they cut out the mass, so the two ends of the GI tract together, get back the biopsy, find out they have lymphoma, they still will need chemo. So again, chemo is sort of your foundation. Sometimes you'll have surgery in there and sometimes you'll have radiation in there as well. So question is, do I use budesonide or prefer prednisolone? So I don't use budesonide. That is a, you need something, that's something they use, I think, for IBDs. So I don't use it. It doesn't absorb. You need something that gets systemic. So we use prednisolone. And guys, there's some things that I say that you're going to ask your oncologist or your vet and may get a difference of opinion. So the disclaimer is you're getting my opinion because you're here. But why do we use prednisolone in kitties? So prednisolone is the active form of prednisone, which is converted in the body, in the liver, from prednisolone to prednisolone. It's estimated about half of kitties don't have the enzyme to make that conversion to the active form. I know plenty of awesome doctors, awesome internists who use prednisolone in cats and not prednisolone. I was trained to use the active form, and so that's why I use prednisolone. I have plenty of kitties that are on pred and they're doing fine, but the kitties that I see, I will put them on prednisolone. If they come in and they're not responding, I will put them on prednisolone. So that's my little pred story. Bev wants to know if a cat has high-grade GI lymphoma and symptoms are acute, so have come on pretty quickly. I'm going to show the question. Oh, and you can't see me. That's okay. Is there always a palpable intestinal thickening? Bev, one of the things that I can tell you is that rarely can we say never and or always in veterinary medicine. So is there always palpable intestinal thickening? Does infiltration occur quickly, or is there a significant subclinical period? Thinking of a geriatric cat that has acute vomiting, diarrhea, weight loss, normal labs, and an unremarkable abdominal palpation. Usually, there's never going to be, I've seen everything. So usually with high-grade lymphoma, usually there will be palpable changes that you can feel. But some cats are fat, some are thin, and I've had some cats that have been completely underwhelmed with what I feel on their exam, but we see things on abdominal ultrasound. Usually with cats with high-grade lymphoma, they will have an abnormal ultrasound. So big lymph nodes, thickened intestinal tract, usually a mass. There's usually something that we can stick a needle in and get an answer. Usually what you're describing, the vomiting, the diarrhea, the weight loss, normal labs, and a normal abdominal palpation when you're feeling is usually more like the low-grade lymphoma. But again, you're seeing this with this acute presentation, meaning the cat got sicker quicker, which fits like high grade. So that, some of these are going to be cats that are going to need, so for cats with low-grade lymphomas, that those are the ones that we often need to do GI biopsies because there's nothing to stick. So that might be something. Another thing, Bev, I'm not sure if you're a vet or a tech. It sounds like you're a veterinary professional. So a lot of these kitties with GI disease, so both of the high and the low-grade lymphomas, have maldigestion issues. So usually I recommend a maldigestion profile to check their vitamin B12 levels. A lot of kitties have low B12 levels, which really exacerbates their weight loss. And in addition to treating their IBD or their lymphoma, we need to supplement their B12 levels. So Bev, I hope that helped. But again, not a clear-cut case from what you're describing. But again, the presentation of getting sicker quicker sounds like high grade, but the normal feeling of the exam. But I would do an ultrasound next if that hasn't been done yet. So Kat's asking, are there strategies to deal with chemotherapy-induced neutropenia and small cell lymphoma? So I'm assuming that we're dealing with leukeran, which is chlorambucil, which is the chemotherapy drug of choice in general for most low-grade lymphoma kitties. And that, so most of the time with other chemotherapy drugs, they get a low white blood cell count about a week later, and it takes the dog or cat a day or 2 or 3 to recover on their own. The body will make more white blood cells. The problem with leukeran, Kat, if we're talking about leukeran, is that it can take the bone marrow a while to recover. So you have to stop the chemo. And the hard part about that is it often, you're not treating the cancer, right? So they can stay on their steroids. I've had some cats just take a week or 2 to recover, and that's great. And usually their cancer will behave in that time period. And then I know that some cats, and I had one dog that I had on leukeran, and his platelets took almost a year to recover from the leukeran. So that is one of the reasons that I really, back in the beginning where I said cats and dogs that are on leukeran, chlorambucil, need blood work the most I'll stretch out is every 6 weeks, because I'm looking not just at the number that the white blood cell, the neutrophils are normal and the platelets are normal. I'm looking at trends. Is that normal trend starting to go down? I'm going to maybe get concerned that we're starting to see that, because what you need to do is stop the chemotherapy. Usually the bone marrow will recover on their own. I have had a few cases where the bone marrow doesn't recover, and it's hard because you can't use other chemotherapy as well. So those can be definitely difficult cases. Again, I'm assuming because you said small cell that it was leukeran. If it was one of the other drugs, lomustine, that can be harder to recover too. But, like vincristine and doxorubicin, most of the time you give the cat, a couple of days, they're going to make more white blood cells and you'll be fine. So I'm not sure, but that would, usually it's time. And depending on the drug and how much time it'll take. Lots of questions about small cell lymphoma today. So this question, with small cell, does a cat have to remain on chlorambucil forever, or can you stop the chemo? So I'm just laughing because this is a great question and a hard one to answer. So most of my kitties have stayed on chronically, to be honest, unless they've had white blood cell or platelet issues or liver issues. What I have found is when I get them off chemo, they relapse, and then it has been hard to get them back in. Usually what I find to be more insulting to the body is the steroids, because chronic steroids can lead to diabetes, and that's a pain in the butt to treat. I've made a couple of kitties diabetics, and not always does it resolve when you stop the steroids. And then you have your kitty that needs to be on insulin, so that always stinks. So usually I will try to taper them off their steroids somewhere around the 6-month mark. So if they were on 10 milligrams, I get them down to 5 at that point, and then I'll try to go to 2.5, and then maybe 2.5 every other day. The cats that I used to get off steroids earlier or at some point, I just find that they relapse. So usually I will keep them on leukeran long term. Again, no one really knows what their right period of time is, but most of the kitties, if the owners can continue to afford it and will, continue to come see me, I will definitely have them stay on it. So, okay, this is another, you guys have great questions. I'm really, really excited because we're hitting on a lot of things that are really important to me. Mariela, I think I'm mispronouncing your name, but I'm trying. You mentioned that vomiting isn't normal. Does that include throwing up hairballs? So this is a great, great question. And so there was the article that came out, it was in 2013, and what they were looking at was the association of cats that had symptoms, vomiting, diarrhea, weight loss, or a combination thereof. So if they had those symptoms and then had an ultrasound with thickened intestines and then went on and got surgical biopsies, did they have disease? And there was 100 cats exactly that had these symptoms. 26 of them, so a quarter of them, went to their vet for their routine exam, and their vet did a great job getting a history and said, your cat's vomiting too much, or your cat's lost weight, or has had diarrhea. And then they went on and got the ultrasound, and then they went on and got surgical biopsies. If they didn't get surgical biopsies, they weren't in the study. So there was like 65 kitties that were not included in the study. Guys, 99 of those 100 cats either had IBD or lymphoma, and most of the lymphoma ones were low grade. There was just a few high grade lymphomas. So it really goes to show you that there's an association between vomiting, diarrhea, and weight loss in cats. And again, it was usually over 1 to 3 months. They had different criteria on there. In that article, they talked about, getting back to your question, what about the long-haired kitties and hairballs? And they're, the discussion was that maybe it's cats with underlying GI disease that are the ones that are vomiting up the hairballs, and that it's probably not normal. And so if they're vomiting up hairballs, maybe it's because they have some underlying GI disease. So I guess I can't say that every cat that vomits hairballs has underlying GI disease, but are they losing weight? Do they have diarrhea? How often are they vomiting, and keeping tabs of that? And sometimes it's literally taking your calendar and circling stuff on it, right? And I know I've talked about that with Robin, with Miku, is actually, because sometimes when you start to do that, you say, oh, it was 5 times this month. That was more than I thought. So I think sometimes keeping a visual log is helpful. So it's not an easy question to answer, Marlela, and I feel horrible if you have a beautiful name that I might be mispronouncing it. But again, I think it's a great question. Okay, so Robin is asking, so back to our nasal lymphoma. So this is hard. So nasal lymphoma is, how do you tell that that's in remission? So, for most cats, we can do an abdominal ultrasound, which is an awake procedure. Their belly shaved, and we use the probe, and we can go and have an internist or your vet toot around and see the different organs. And and she says, how do we know that they're in remission? So we do a CT scan. So in general, we're not going to go back and biopsy normal looking CTs. If there was abnormal tissue, or if the tumor was growing back and filling the nasal cavity, then we would be suspicious, and then we would talk about rebiopsying it. So the hard part about a cat with nasal lymphoma, it requires doing a CT scan, which is more expensive and does anesthesia. And so Miku's parents come see me about once a year at the different practices that I'm at, and sometimes go and get their knives sharpened while I'm CTing, which always makes me a little bit nervous. But so far, Miku has been in remission. So that's why we do the CT scans, because I can't, even if there was facial deformity, a CT scan is going to be the best way to be able to tell for a cat with nasal lymphoma if they're in remission. Jane, good question. So Jane wants to know a little plug for where I am. She wants to know where I am now. I am at the Veterinary Referral and Emergency Center in Norwalk, Connecticut. So VCA VREC. If you go to my website, there's a link on there, or you can Google it. But Veterinary Referral and Emergency Center in Norwalk, Connecticut. And I'm there most Mondays and Wednesdays. I do a lot of speaking and traveling and teaching, which is my other passion. So sometimes my schedule is a little bit different, but this month I'm there pretty much both Mondays and Wednesdays. Let's see. See, so now Kim is saying, would uneven pupil dilation have anything to do with lymphoma? So Kim, I know you asked another question. I can't remember where your cat's lymphoma was. Kathy asked a good question. I'll come back to that. It's usually a neurologic issue. So you can, one thing we didn't talk about is you can have lymphoma in the brain, in the spinal cord, so in the central nervous system as well. I've seen lymphoma in the urinary bladder. There's lots of different places that you can have. So I know now we're all going to go look at our pets and be like, oh my God, they have lymphoma. So Kim, I can't remember where your cat had lymphoma. I'll have to scroll to see. So, okay, this is a great question. Marlela, good questions going on here. So should kitties be on a particular type of diet if they have small cell lymphoma? So awesome question. So Kim just asked, sorry, just to go back, the abdominal lymphoma, they don't usually have central nervous system involvement. So if you continue to see the pupil dilation, tell your veterinarian or your oncologist and they can do a full neurologic exam. So not something we usually see with gastrointestinal lymphoma. Okay. So the question is, should kitties be on a particular type of diet if they have small cell lymphoma? So the reason that this is a great question is there is usually a continuum between inflammatory bowel disease and small cell lymphoma. And so I mentioned that your cat, like my kitty Jeter, could have inflammatory bowel disease, and he started out of that when my mother-in-law noticed that he was losing weight, and he was always a vomiter, guys, and we accepted it as normal. Like, oh, he's just one of those cats that vomits. Guess what? It wasn't normal. And then he was losing weight, and then my mother-in-law noticed, and then we diagnosed him with inflammatory bowel disease. And we did change him to what is called a novel protein diet, right? So because it's too much inflammation in the bowel. So we switched to a novel protein diet. He was on Hill's, I think, ZD for a long time. I'm a big fan of probiotics. So a lot of these kitties will then transform and become small cell lymphoma. We also think that if your cat was just diagnosed, never had IBD and then is diagnosed with small cell lymphoma, there's often a possibility that adjacent in other parts of the intestinal tract that they have inflammatory changes as well. That's why I love to check their B12 levels. And I often will do a lot of the things for my low-grade small cell lymphomas that an internist would for an IBD kitty. So a novel protein diet, putting them on probiotics, and things like that. So there's a lot of different diets out there, but I would talk to your veterinarian. Usually they're prescription diets, but again, I used Hill's ZD for my kitty when he had his IBD. Sorry, guys. I know it's getting to be, it's almost 10 o'clock, and I know it's late, and you guys have a lot of questions. I'm just trying to scrolling through, but I think we did a great job. So Sarah asked a question, and Sarah, I don't know this answer. I don't make stuff up if I don't know it. So how frequently does small cell change into large cell? If they live long enough, it is inevitable. I don't know that I would say that. I don't know that we know that answer. I don't know that it would be a hard study to do and know for sure. I don't see it all that often, but we see it. So I think it's good to know that it's a possibility. And so often, because you remember, those kitties with small cell lymphoma are often the ones that we had to do some sort of surgical biopsy or endoscopic biopsies. So a lot of the time, they've been on prednisolone, they've been on Leukeran, and then they stop responding, right? And so often you're just going to be trying other chemo, which is going to be the sort of next level up. And I've had some kitties that go on to COP chemotherapy and do quite well for a while. So I wouldn't say it's inevitable. And sometimes my point is, you're not sure, are they a resistant small cell lymphoma that just requires more intense chemotherapy, or are they a large cell? If they have a big lymph node on their ultrasound, I'm going to go ahead and aspirate it and see if it's small cell or large cell. But a lot of times it's just a relapse of their symptoms. So vomiting, weight loss, and or diarrhea, and nothing really to aspirate. And I tell the owners, oh, we have to go in and do surgical biopsies. They're like, And I'm like, all right, or we can change chemo. So we just change chemo. Again, if I do an ultrasound and there's a big lymph node or a GI mass that we can do an ultrasound guided, relatively non-invasive aspirate, we're going to do that. So that would be my answer there. So another great question, Kathy said, would you treat regardless of age, 17-year-old kitty slowly gaining weight on Pred and B12? He's watching and listening. So yes, Kathy's kitty, I do not, I don't think age is a disease alone. I've had some 8-year-old kitties that were diabetics and had more issues than some of my 17-year-old kitties. So I personally would treat, and now that he's listening, he'll hate me if I say don't. but I'm a treater, guys. And so what works for me may not work for you. And I always try to remind myself of that. But, the other thing with chemo, whether you're starting injectable chemo or Leukeran, is it's not a contract. You can stop. So, and if they're having side effects, the side effects usually stop and go away once you stop chemotherapy. And like I mentioned at the beginning, cats tolerate chemotherapy better than dogs. So I think the benefit, cats with high-grade lymphoma, the aggressive lymphoma, with no treatment, it's a month. And even if they're in those kitties that are the 4 to 6 months, it can be a really good 4 to 6 months. And that's a significant period. If they're one of the responders, a year, 25% at 2 years. And if it's a low-grade lymphoma kitty that you can get, a year and a half to 2 years, I personally think it's worth it. So that's Dr. Sue's 2 cents. Take it or leave it. So Kathleen Jack says, we had a 20-year-old, this is great, a 20-year-old kitty with mast cell cancer. We were told that if we removed his spleen, he could live a year. We had a hard time until someone told us old age isn't a disease. We did the surgery and he had a great 364 days. So just short of a year. So and what works for one family doesn't always work for another. So as I've gotten older, I try not to judge. I just try to give people information and take it from there. So Sarah, just as we're wrapping up, a few more good questions. What is the rate of weight loss between IBD kitty and lymphoma? So you're probably thinking the small cell low grade lymphoma. We see them both. I don't know the numbers offhand. It's probably more, usually the percentages of vomiting, weight loss, and diarrhea are usually all a little bit higher with IBD, with lymphoma versus IBD. But I do some lectures with Susan Little, who's the cat vet, and she's phenomenal. And she just talks about, like, for most diseases in cats, like, the symptoms are really the same. And it's like weight loss and vomiting are just two of the main ones that are on there, and they hide their disease really well. So it's not always easy to tell. All right. All right, guys. I think we are going to wrap it up at that. I'm just going to give you a couple of announcements, I think, just to remind you. A couple of things. We reorganized my YouTube page. There's now a section in there with, like, everything that you need to know about cancer. So we talk about myths and misconceptions. We talk about chemotherapy. I talk about the medications that if your pet is going through chemo that I want you to have on hand at home. Oh, guys, really, really important for all you, cat owners out there. Do you know about Meritaz? Do you guys know about Meritaz? This is a brand new medication that was just FDA approved for cats. It's an appetite stimulant. They did a placebo study and it actually promotes weight gain. So it's a transdermal medication that you can put on your cat's ear. So we were talking about how difficult it is to medicate cats and give oral medication. So this is an appetite stimulant. It's mirtazapine, which is a human medication, but now we're not using the human pills. So this is Meritaz. It's from a company called Kindred Bio. It's been on the market for about half a year. But again, you put it on their ears, you alternate each ear daily, and that is a great thing. So but again, if your cat's going through chemo, you should watch the video about medications that I want you to have on at home. Guys, my favor for you, I get on here and I'm giving you all this information. If I could ask you one favor, if you haven't done it yet, if you could please go to my YouTube channel and subscribe, that would be super fantastic. Just hit the subscribe channel, and these videos, there's a whole section of Q&A. You can go look at the last cat one as well. Maybe there's some topics in there that will be helpful for you that are different than we talked about. Don't forget my YouTube or my Facebook page. Sorry, my website. You can see where I am. It's really the hub for where I am, where I'm speaking. My videos, my skin maps are there. Guys, if you, bad faux pas. This is my dog one, but my dog map and cat skin maps are there, so you can keep track of lumps and bumps. You know how I feel about that. My chemotherapy information sheets are on there as well, so you can download those from the pet resource. what to do if your pet is having side effects. These are all, late guys, these are all on my website in the pet resource section. So go there. You know, everything's there that you could need. If you guys have suggestions of other things, you know, send me a message, put a comment. You know, definitely let me know of other things, other cat topics that you guys want. Let me know. We'll take a look at those. And again, this will be replayed on YouTube. You guys know I'm really big about see something, do something, why wait, aspirate. So remember, if your cat has a lump or bump, if it's the size of a pea and been there a month, go to your veterinarian and get an aspirate. You know, really big. I think you all should have calipers on hand at home. We have little pens, calipers, and my digital calipers are on my website as well. So, you know, if you're a veterinarian or a tech or even a pet owner, you know, these go really, really well with your skid maps to keep track of lumps and bumps. So that's on my website. The Dr. Sue 2019 is a little discount code. If you want to buy those, you can get those on my site as well. All right, guys, that's it. Kick Cancer's butt. Thank you so much for coming. Thank you to the Facebook gods for actually working tonight. Really glad that you took some time out of your day. Go get some rest. And I think the next event is going to be the 15th of April. I don't remember what the topic is, but we'll post it. And thank you so much for joining. Guys, if you have a friend that you think would benefit from this information, don't forget to tag them so they can see this video. Same thing this will be on YouTube probably tomorrow. If you have a friend, please share it. There's a little share button. Just click it, email it to them, Twitter it to them, tweet it to them, post it on their page. Please share the information. The more people that we get less scared about cancer, and early detection saves lives, guys. So we can do it. I really appreciate your time, your enthusiasm. Awesome questions, you guys. This was fantastic. You guys rock. You guys really, really rock. Thank you so much. Have a great night. Kick Cancer's butt. Till next time, guys. Bye.